You finish dinner at 6. You settle in for the evening. Maybe you watch some television, read a book, and around 9 or 10, that familiar feeling hits. You're a little hungry. Nothing major, just a small snack before bed. So you head to the kitchen. Maybe it's a bowl of cereal, maybe some cheese and crackers, maybe ice cream. Completely innocent, right? Just a light snack to hold you over until morning. But what if I told you that this single habit, this seemingly harmless late-night eating, is directly linked to heart attacks, strokes, and sudden cardiac death in people over 65? I'm Dr. Arya, and I've spent 25 years specializing in geriatric medicine and cardiovascular health. And what I'm about to share with you is based on research that most doctors aren't discussing with their patients, because the timing of when you eat may be just as important as what you eat, especially after 60, especially in the 3 hours before you go to bed. And one type of food in particular, something millions of seniors eat every single night, is causing serious, measurable damage to your heart while you sleep. Let me tell you about Dorothy. She was 68 when she came to my office, frustrated and frightened. She'd been waking up in the middle of the night with her heart racing, palpitations that felt like her chest was going to explode. She'd been to the emergency room twice. Both times, by the time they got her on a monitor, her heart rate had settled. They told her it was anxiety, sent her home with instructions to relax. But Dorothy knew her body. She knew something was wrong. We sat down and went through her entire routine. Her medications were fine. Her daytime diet was reasonable. And then I asked her what she ate in the evening. Every single night, around 9:30, she had a snack, usually something salty. Pretzels, chips, sometimes salted nuts. She'd been doing it for years. That was the problem. We eliminated the late-night eating entirely, and within 1 week, the palpitations stopped. Completely. Dorothy hasn't had a single episode in 3 years. It wasn't anxiety. It wasn't a heart condition. It was salt eaten too close to bedtime, causing fluid shifts and electrolyte imbalances that were triggering arrhythmias while she slept. Here's what you need to understand about what happens in your body when you eat before bed. When you consume food, any food, your body goes to work. Your digestive system activates, your stomach produces acid, your pancreas releases insulin. Blood flow redirects toward your digestive organs and away from other areas. Your heart rate increases slightly, your blood pressure rises. All of this is normal during the day when you're upright and active. Your body is designed to handle it. But at night, when you're lying flat, when your body is supposed to be in rest and repair mode, eating triggers a physiological conflict. Your digestive system is saying, "Wake up, we have work to do," while your cardiovascular system is trying to slow down for sleep. And for older adults, this conflict creates very real, very dangerous problems. Let's start with the most critical issue, nighttime blood pressure. Your blood pressure is supposed to drop while you sleep. We call this nocturnal dipping, and it's essential for cardiovascular health. A healthy dip is 10 to 20% below your daytime baseline. This gives your heart and blood vessels a chance to recover from the stress of the day. But when you eat within 3 hours of bedtime, especially certain types of food, your blood pressure doesn't dip properly. It stays elevated. In some cases, it actually rises. Research published in the European Heart Journal found that people who ate within 3 hours of bedtime had significantly impaired nocturnal blood pressure dipping, and people who don't dip at night have a 35% higher risk of cardiovascular events, heart attacks, and strokes, compared to those who dip normally, 35%. That's massive, and it's directly linked to the timing of your last meal. Now let's talk about the absolute worst thing you can eat before bed: salt, sodium. It's in almost everything people snack on in the evening: chips, crackers, pretzels, cheese, processed meats, canned soup, frozen dinners, bread, even things you don't think of as salty. And here's why it's so dangerous at night. When you consume sodium, your body retains water to maintain the proper balance of electrolytes in your bloodstream. That's normal physiology. But when you eat salt and then lie down for 8 hours, that fluid doesn't distribute evenly the way it would if you were upright and moving around. Instead, it pools. It increases blood volume. And increased blood volume means increased pressure on your blood vessel walls. Your heart has to work harder to pump against that extra volume while you're sleeping, while it's supposed to be resting. Over time, this nightly pattern of elevated pressure damages your arteries, strains your heart, and dramatically increases your risk of heart failure. But it gets worse. That fluid retention doesn't just affect your blood pressure. It affects your heart rhythm. Electrolyte balance, the ratio of sodium, potassium, calcium, and magnesium in your blood, is absolutely critical for normal heart rhythm. Your heart's electrical system depends on precise electrolyte concentrations. When you flood your system with sodium late at night, you disrupt that balance. And in older adults whose hearts are already dealing with age-related changes, that disruption can trigger arrhythmias, atrial fibrillation, premature ventricular contractions, those frightening palpitations that send people to the emergency room, just like Dorothy. And the terrifying part is, these arrhythmias happen while you're asleep. You might not even wake up. Your heart could be going into irregular rhythms for hours, and you'd never know unless you were on a monitor. Let me give you the science behind this because I want you to understand exactly what's happening inside your body. There's a reason your grandmother might have told you not to eat before bed. Traditional wisdom understood something medicine is only recently quantifying. A study from the American Heart Association followed over 12,000 adults for more than a decade. They found that people who consumed 20% or more of their daily calories after 6 p.m. had a significantly higher risk of hypertension, high blood pressure, compared to those who ate earlier in the day. Another study specifically looking at older adults found that eating within 2 hours of bedtime was associated with a 76% increased risk of heart attack. 76%, let me say that again. If you're eating right before bed, especially if you're over 65, you're nearly doubling your heart attack risk compared to someone who stops eating earlier in the evening. And it's not just about salt, though, that's the worst offender. Eating large amounts of carbohydrates or sugar before bed causes insulin to spike. Insulin is a powerful hormone, and among other things, it causes your kidneys to retain sodium. So even if you're eating something sweet, not salty, you're still creating a sodium retention problem. You're still interfering with normal nocturnal blood pressure dipping. You're still putting stress on your cardiovascular system when it should be recovering. Then there's the issue of acid reflux. When you eat and then lie down, stomach acid can flow backward into your esophagus. You feel it as heartburn. Uncomfortable, sure, but here's what most people don't realize. Acid reflux doesn't just affect your esophagus. It can trigger what's called a vagal response. The vagus nerve, which runs from your brain down through your chest, can be stimulated by acid in the esophagus. And when the vagus nerve is stimulated, it can slow your heart rate dramatically or cause irregular rhythms. I've seen patients whose nighttime arrhythmias were completely resolved just by treating their reflux and stopping late night eating. Now let's talk about what happens to your sleep quality, because this ties directly back to your heart health. When you eat before bed, your core body temperature stays elevated. Your metabolism is active, your digestive system is working. All of this interferes with deep sleep. You spend more time in light sleep stages and less time in the restorative deep sleep your body needs. Poor sleep quality raises cortisol levels. Cortisol raises blood pressure and blood sugar. It's a vicious cycle. And chronic poor sleep is an independent risk factor for heart disease, separate from everything else we've talked about. So late night eating disrupts your blood pressure, disrupts your heart rhythm, and disrupts your sleep, which then further damages your cardiovascular system. It's a cascade of harm, and it's happening night after night in millions of households. I want you to think about your own routine right now. What time do you typically eat dinner? What time do you go to bed? And most importantly, do you snack in between? If you're eating dinner at 6 and going to bed at 10, that's 4 hours. That's actually fine if you don't snack. But if you're eating dinner at 7 and snacking at 9:30 and going to bed at 10, you've got food in your system right up until you lie down. That's the danger zone. Your body doesn't have time to process that food while you're still upright. Everything I just described, the blood pressure elevation, the fluid retention, the electrolyte disruption, it's all happening to you every single night. So what are the absolute worst foods to eat before bed? Let me give you a specific list so there's no confusion. Number 1, anything salty. Chips, crackers, pretzels, salted nuts, popcorn with salt, cheese, especially processed cheese, deli meats, bacon, sausage, canned soups, frozen dinners, fast food, pickles, olives, salty condiments. All of these are loaded with sodium, and all of them will cause fluid retention and elevated nighttime blood pressure. Number 2, sugary foods. Ice cream, cookies, cake, candy, sweetened yogurt, even fruit juice. The insulin spike interferes with sodium excretion and disrupts your blood sugar regulation overnight. Number 3, large portions of anything. Even if it's healthy food, a big meal before bed keeps your digestive system active for hours. Your body can't rest. Your heart can't rest. Number 4, caffeine. Coffee, tea, chocolate, energy drinks, even some medications contain caffeine. It raises heart rate and blood pressure and obviously interferes with sleep. And number 5, alcohol. A lot of people have a drink before bed thinking it helps them sleep. It doesn't. It might make you drowsy initially, but it fragments your sleep later in the night and it causes dehydration, which concentrates your blood and raises blood pressure. Here's what I tell every patient in my practice who's over 65. Your last meal or snack should be at least 3 hours before bedtime, ideally 4 hours. If you go to bed at 10 gallon p.m., finish eating by 7 gallon p.m. at the absolute latest. 6 o'clock is better. I can already hear some of you saying, but I get hungry. I can't go to bed hungry. I'll wake up in the middle of the night starving. Let me address that because it's a legitimate concern. First, if you're getting genuinely hungry 3 hours after dinner, your dinner probably isn't substantial enough or balanced enough. Make sure your evening meal includes adequate protein and healthy fats. These keep you satisfied longer. A dinner of just pasta or just salad isn't going to hold you. But a dinner with vegetables, a good protein source like fish or chicken or beans, and some healthy fat like olive oil or avocado will keep you full for hours. Second, your body adapts. If you've been snacking before bed for years, your body has learned to expect food at that time. Your stomach produces acid in anticipation. You feel hungry on schedule. But if you stop the pattern within about a week, that programmed hunger disappears. Your body adjusts. The cravings stop. You have to get through the transition period, but it's not permanent suffering, it's temporary adjustment. And third, if you absolutely must have something, if you're genuinely experiencing low blood sugar or you have a medical condition that requires evening food, choose wisely. A small handful of unsalted nuts, a few slices of cucumber or celery, a small amount of plain yogurt, something with minimal sodium, minimal sugar, minimal volume, not a bowl of cereal, not a sandwich, not ice cream. We're talking about a tiny amount of food to take the edge off genuine hunger, not a recreational snack because you're bored or it's habit. Let me tell you what happened with one of my patients, Harold. He was 74, type 2 diabetic, high blood pressure, and he was on 4 different medications. His blood pressure was still poorly controlled despite maximum doses. I went through his entire routine, and every single night he was eating a bowl of canned soup around 9 p.m. He thought he was making a healthy choice. Soup, vegetables, low calorie. But that soup had 800 milligrams of sodium per serving, and he was eating it right before bed. I explained what it was doing to his nighttime blood pressure. We stopped the soup. Within 2 weeks, his morning blood pressure readings dropped by an average of 18 points. We were able to reduce one of his medications. He felt better. He slept better. One simple change. Stop eating salty food before bed. That's how powerful this is. Now I need to talk about a specific group of people who are at even higher risk. If you have heart failure, if you have kidney disease, if you have poorly controlled high blood pressure, if you've had a previous heart attack or stroke, late night eating is especially dangerous for you. Your body already struggles to regulate fluid balance. Your heart is already under strain. Adding the stress of late night sodium and fluid retention on top of that is like throwing gasoline on a fire. You are in the highest risk category, and you must be rigorous about this. No eating within 4 hours of bedtime, no exceptions. This isn't a lifestyle suggestion for you. This is medical necessity. Let's also talk about medications, because timing matters here too. If you take a diuretic, a water pill for blood pressure or heart failure, when are you taking it? Most people take it in the morning because nobody wants to be getting up to urinate all night. That makes sense. But here's the thing. If you're taking your diuretic in the morning and then eating salty food at night, you're working against your own medication. The diuretic is trying to get rid of excess fluid and sodium, and you're putting it right back in at night when the medication has worn off. Talk to your doctor about this. Some patients benefit from splitting their diuretic dose, taking a small amount in the late afternoon to help with nighttime fluid balance. But this has to be individualized. Don't change your medication timing without medical guidance. Here's another issue that people don't connect. Swelling in your legs and ankles. A lot of older adults have some degree of edema, swelling by the end of the day. Gravity pulls fluid down into the lower extremities over the course of the day. That's relatively normal, but if your ankles are significantly swollen every evening, and especially if you're eating salty foods at night, that fluid isn't going away while you sleep. It redistributes. Some of it moves into your lungs. This is called pulmonary congestion, and it makes your heart work much harder. You might wake up short of breath. You might feel like you can't get a deep breath lying flat. People prop themselves up with extra pillows and think it's just how they sleep now. No. It's fluid overload made worse by late-night salt intake. And it's treatable by changing when and what you eat. I want to give you a very specific action plan because knowing the problem isn't enough. You need to know exactly what to do. Step 1. For the next 7 days, write down everything you eat after 6 p.m. and the time you eat it. Also write down what time you go to bed. This is just data collection. Don't change anything yet. Just observe your pattern. Step 2. Look at what you wrote down. How much of what you're eating in the evening is high in sodium? How close to bedtime are you eating? Be honest with yourself. Step 3. Starting on day 8, stop eating 3 hours before bedtime. Set a hard cutoff time. If you go to bed at 10:01 p.m., nothing passes your lips after 7 p.m. except water. Do this for 2 weeks. Step 4. During those 2 weeks, pay attention. How do you feel in the morning? Is your energy better? Are you less puffy? Check your blood pressure in the morning. Write it down. Compare it to your baseline morning readings from before you made the change. I will tell you what most of my patients report. Within 1 week, they sleep better. Within 2 weeks, their morning blood pressure is lower. Their ankles are less swollen. They have more energy. Some notice their heart palpitations have decreased or stopped entirely. This isn't a miracle. This is simply removing a stress that your cardiovascular system was dealing with every single night. You're giving your body a chance to actually rest. Now I want to hear from you. Do you eat before bed? What do you typically eat? Have you ever noticed your heart racing at night or woken up feeling puffy and swollen? Write it in the comments. Tell me what time you typically stop eating in the evening. Your experience matters, and it might be exactly what someone else needs to hear to make a change. If this video just explains something you've been experiencing and couldn't figure out, share it. Send it to your spouse, your friends, anyone over 60 who might be unknowingly damaging their heart with late night eating. This is information that should be discussed at every cardiology appointment, every primary care visit for seniors, but it's not. So I'm telling you directly. What you eat before bed matters. When you eat matters. And for your heart, for your blood pressure, for your longevity, stopping eating 3 to 4 hours before bed might be one of the single most impactful changes you can make. Next week, I'm going to talk about another nighttime cardiovascular danger that almost nobody knows about. Sleeping position and how it affects your heart. If you sleep on your left side, your right side, your back, it actually makes a difference to your heart function and your blood pressure. You're going to want to see that one. Subscribe to Dr. Arya Senior Health so it's waiting for you. And one last important thing. Everything I've shared today is based on current cardiovascular research and my 25 years of clinical experience, but this is educational information, not personal medical advice. Your health situation is unique. Your medications, your conditions, your specific needs require individualized medical guidance. Use what you've learned here to have a better conversation with your own doctor. Be informed, be proactive, take care of yourself.